Say hi. Oh, very good evening, all of you. Welcome to our final live session of this week, case-based discussions made easy. Please confirm the audio and video streaming, and if there are no issues, we can go ahead as soon as possible. So I hope you guys are all ready. Yeah, do let me know. Right. A very good evening once again. So as I said, this will be our final live session for this week, case-based discussions made easy. I'm glad everything is fine. So let's go ahead with that discussion. Right. So today's case-based discussion, we'll go ahead with the following context. A 26-year-old pregnant woman in her second trimester visits your dental clinic with a chief complaint of pain in upper left back tooth region. Intraoral examination reveals root stumps in relation to tooth 6. She had similar episodes of recurring pain in the past as well. IOPA reveals periapical radiolucency in relation to tooth 6. So here are the keywords of the hints which you have related to this context or case. So also Toffee will be joining us for this particular session, and she'll be very attentive, I hope. So these are the hints or keywords you have. We're talking about a pregnant woman who is in her second trimester with a chief complaint of pain in upper left back tooth region. So intraoral examination revealing root stumps is another keyword you have. So she had similar episodes. So past dental history is positive in terms of pain in that particular region. IOPA reveals periapical radiolucency in relation to tooth 6. So before you jump into answering this question, I'm sure you'll answer this even without me posing a question, but before you do that, I suggest you to wait and check out the questions. So I hope it's clear. I hope the context is clear. Observe the keywords carefully. Pregnant woman, second trimester, chief complaint, clinical examination revealing specific details, along with radiographic presentation. So here you go with the first question. What is the best line of treatment in this particular context or case? Option A, wait and watch as the patient is pregnant. Option B, perform pulpectomy to manage symptoms, at least for now, as she is in second trimester. Option C, extraction. Option D, refer patient to her physician. So which one do you think is more appropriate answer? I'm sorry for the spelling mistake of the physician. So it's a typo. So among the given options, which one do you think is more appropriate answer? So what would you do? We're talking about a pregnant patient. We're talking about the second trimester. Can we go ahead with any kind of treatment, or is it better to choose option D? Because whenever we are in doubt, whenever a patient has a systemic manifestation, need not be a pathology, but even related to normal physiology such as pregnancy, there is nothing wrong in referring the patient to her physician. So what do you say? Should we refer the patient to a physician for consent, or should we symptomatically manage this particular case by choosing option B, or should we just wait and watch so that she can get her treatment completed after delivery, or should we just go for extraction? So which one of the following options do you think is more appropriate answer? So in fact, we have discussed these treatment aspects, like what kind of treatments can be given in specific trimesters. So we'll try to go through that in brief. First of all, we'll talk about treatment recommendations in second trimester. We can go with oral hygiene instruction and plaque control. Scaling, polishing, and curettage can be performed if necessary, including curettage. Controlling of any active oral disease is important, and it can be done in case of second trimester. Also, it's important that we avoid routine radiographs in second trimester. We can, of course, go with selective radiographs, if at all indicated. In this particular context, we have gone for IOPA. Yes, radiographs can be taken, and there is no absolute contraindication provided you're using thyroid apron, thyroid collar to the patient as well, right? And along with that, another important recommendation during second trimester when it comes to treatment aspect is elective dental care is safe in second trimester, which includes root canal treatment, restorations, as well as extractions. So as some of you, I think majority of you have chosen option C, extraction is the right answer. Because in the context, we mentioned that it's a case or context of second trimester. What is the best line of treatment in this particular context? Yes, we can go with extraction. It's not an absolute contraindication. So may not refer the patient to her physician, not required, right? So, I mean, following standard literature and then applying the same clinically. So option C, and as one of you rightly mentioned, we can go with elective dental care, which is very, very important, such as restorations, root canals, etc. Now, let's move on to the next question. Treatments indicated in second trimester include all of the following except. So this is to just test you whether you have listened attentively to the information which I've just provided. Option A, plaque control. Option B, elective dental care. Option C, control of active diseases. Option D, all. Option E, none of the above. So which one do you think is more appropriate answer? And as we have been discussing, I mean, each trimester has its own significance. So in case of first trimester, we usually don't go with elective procedures. We're talking about organogenesis and other important structures being formed within the fetus. So elective dental care is not indicated in case of first trimester. But second trimester, yes, we can go with elective dental care. What about third trimester? Usually they say third trimester, in the later half of third trimester, any kind of treatment, elective treatment, should be postponed because of a specific reason, a reason which we'll discuss a bit later. So treatments indicated in second trimester include all except. So which one do you think is more appropriate answer? So plaque control, yes, it can be done. Elective dental care, yes, it can be done. Control of active diseases, yes, it has to be done, and it can be done in second trimester. So all of the above, yes, but we're talking about except, so which cannot be done. As majority of you, I think, have rightly chosen option E is right answer. Do award yourself +4. Please keep a tab on your scores. So first question +4 if you have answered it right. Second question again +4 if you have chosen option E. Very good. So it's a clear-cut indication that you are listening to what I am giving out in the process of this live session. Now let's move on to the next question, third question. Emergency dental procedures are indicated in, this is very, very important. Let's see how many of you are going to answer it right. Emergency dental procedures are indicated in first trimester, second trimester, third trimester, all of the above, none of the above. So what do you think? What's your opinion in regard to management of an emergency situation? Patient comes with severe pain. She could be in first trimester, she could be in second trimester, who knows? She could be in third trimester. So emergency dental procedures. Can we go ahead in case of first, second, third? So which one do you think is more appropriate answer? See, based on what we have discussed, yes, you can choose option B, second trimester. It's relatively safe. Oh, yes, but what about first trimester? Do you ask the patient to suffer if she has pain? What if the infection is spreading within facial spaces? Don't you think it could lead to dangerous complications, including cellulitis, various space infections? We have seen the sequelae of pulpo-periodontal infections very recently, right? What would be the fate of a pregnant patient if she has severe pain or an emergency in third trimester? What would you do? In case of emergency, any dental procedure, any emergency dental procedure can be performed in all of the above. There is no absolute contraindication. Consider this very, very important. All emergencies can be addressed in regard to any trimester. So just keep that in mind and consider this very, very important. Emergency dental procedures are indicated at all times during pregnancy and can be performed during any trimester when a delay in necessary treatment could result in significant risk to mother and an indirect risk to fetus. So consider this very, very important. Just because we discussed that second trimester is relatively safe period to go ahead with elective dental procedures, including extractions, root canals, etc. It doesn't mean that you can also go for emergency dental procedures only in second trimester. Emergency is emergency. And by the way, what's the difference between an urgency and emergency? Can anyone please say? In the context of treatment, what's the difference between urgency and emergency? It's very interesting. See if you can find out, or if you have an idea, do let me know in the comment section. Yes. Very good. So option D, right answer, do award yourself +4. Fourth question, penultimate question. So you have assertion and reason, bit lengthy question. Let's see how many of you are going to get it right. Assertion: for elective dental procedures, the ideal, I'm sorry, I can't see this because of my own image, the ideal period, right? So for elective dental procedures, the ideal period for complete dental treatment of a pregnant woman is between 14 to 20 weeks of pregnancy. Reason: at this stage, there is no risk of teratogenesis, nausea and vomiting have subsided, and the uterus is not yet large enough to cause discomfort. So what do you think? Does it make any sense? Assertion and reason. Do you think both assertion and reason are true, or do you think they're false? If you think they are true, is reason justifying assertion? Yeah, it's good to see that some of you are answering the difference between emergency and urgency. Sidra, Danish, very good. I'll get back to your comments very soon. So what do you think? Elective dental procedures. Ideal period, we're talking about 14 weeks to 20 weeks of pregnancy. Is that true? And is the reason appropriate? So which one do you think is more appropriate answer? In fact, as we have been discussing right from the beginning, the ideal phase is usually second trimester. We can go ahead with treatments in this particular trimester, including not just emergency, but also elective dental procedures. So which one of the options do you think is more appropriate? I see Sidra, Navya, Pharoah, you guys have done a wonderful job. You covered the first three options. And if rest of you can cover either option D or option E, it's a clear-cut indication that one of you is definitely right. And this is called teamwork. Okay, I'm just kidding. So which of the following options do you think is more appropriate? Assertion is true, reason is false, or is it option A? Okay, time's up. Well done. Both assertion and reason are true, and reason justifies assertion. 40 to 20 weeks of pregnancy is nothing but your second trimester, and it is favorable because of the given reason. First trimester, we're talking about organogenesis, increased risk to exposure to teratogens or susceptibility to teratogens, including third trimester. Also, nausea and vomiting might have subsided in second trimester, which is usually more in case of first trimester period. And the uterus is large enough in case of third trimester. So if there is gravid uterus compressing your inferior vena cava in third trimester, we call it as inferior vena cava compression syndrome or supine hypotensive syndrome, as you're all familiar with. Because of lying down position in a dental chair, because of large or gravid uterus compressing the inferior vena cava in supine position, the venous return to heart decreases, leading to hypotension, which is called supine hypotensive period. And this is the reason why treatments are deferred to a later date if a patient comes to your clinic for elective dental treatments in third trimester or late third trimester. If it's an emergency, yes, we can go ahead, but if not, it's better to postpone treatment, right? So supine hypotensive syndrome, another important point which you can make a note of, just check out relevant information. Also, we'll be providing you some reference material. You can go through that as well in your classes. So as majority of you, I don't think it's majority, but minority. As minority of you have rightly chosen option A is right answer. Now let's move on to the final question. And this is a record for me personally, because in the past 2 or 3 sessions, I've been leaking key, but it hasn't happened in this session. We are very lucky. So match the following. You have 3 columns. See if you can match them and give me the right answer as soon as possible. Your time starts now. I've just started the timer. You have only 30 seconds to answer this question. 5 seconds already done. First trimester, second, third trimester on one column. Another column, you have the time split corresponding to these trimesters. And third column, you have some indications or points which are in sync with those trimesters. So try to identify that. Time's up. 30 seconds. Okay. So since we have been discussing all of this, I thought you would answer it very fast, but I'm going to give you another 30 seconds if you want. Again, I'm starting the timer now. Yeah. We're already done with 5 seconds. So who is going to give the first answer and the right answer? That is, speed and accuracy both do play a very important role in a competitive exam such as NEET MDS. Very good. Shubhangi is the first person to give a partial answer. Okay, well done. Sidra, Shriti, again, you can employ teamwork. Each one of you can share the chores and then answer as a collective unit. That I would definitely say teamwork the second time. Yeah, time's up. 2 minutes, more than 2 minutes. So you have the following options. So let's go through each one of them. For first trimester, so as you can see in second column, it matches with the second option, A2. That is the first year of last menstrual period to 13 weeks of gestation, 13 weeks, 6 days of gestation, okay? So A matches with 2, which matches with, in the third column, the first one. That is patient education on maternal oral changes. Because first trimester, we should educate them, increase their awareness, especially about several manifestations affecting the gingiva. We have this pregnancy tumor and so many other lesions, periodontal disease, dental caries, salivary changes. So maternal oral changes is a possibility and patient education has to be done on the same. Second trimester corresponds to option 3 in second column, which in turn corresponds to option 2 in third column. I hope I'm right. Yeah, elective dental care is safe. And third trimester corresponds to option 1 in second column and option 3 in third column. So increased risk of supine hypotensive syndrome. So since you have the answer, let me just take this as an opportunity to correct these spelling mistakes. Yeah, and also we have another spelling mistake here. Physician, yes, we got it right. So now you can also find the key. You can see it's all burning up on the slide. So A21, B32, C13 seems to be a wonderful password code. You can use it as your password code. Okay, yeah. But don't tell which account you are employing the same. Very good, well done. Now let me know what your score is. Yesterday's session, buccal bifurcation cyst. I know it's very, very challenging to answer. And I didn't ask you to reveal your scores, but this session, I'm sure you have done extremely well. So what are your scores? So I have the following homework questions. Do reveal your scores. In the meantime, let's check out the homework questions. First one, is there increased tooth mobility in pregnant patients? Yes or no? If yes, why? If no, why not? Second homework question, is there any association between periodontal disease and preterm labor? So I wanted to find out about the same. There are several studies on this, a lot of research going on. Latest information is available and it's very, very interesting to try finding out association between periodontal disease and preterm labor. And third question, in fact, I think one of you have posted a comment. I've just gone through it like that, like a flash, but I think I got the gist. So what or which is a relatively safer analgesic and antibiotic in pregnant patient? You ask me a question, I'm asking you the same question. So which is a relatively safer analgesic and antibiotic to treat dental pain in pregnant patients? Right? It's a general one, it's more generalized, but what about mild pain, moderate pain, or severe pain? Now I'm giving you the category. So which medication do you think is relatively safer? Because patients, pregnant patients often visit clinics, dental clinics. You should be equipped with this information to address their symptoms, isn't it? Apart from medication, of course, we need to, and we can perform several treatments during pregnancy by taking utmost care. Don't you think so? Right? So I hope it's clear. And that is all I wanted to share in this particular live session. And I missed something yesterday. Before revealing homework questions in last session, I have given you a table from Schaeffer's 7th edition, I reckon, giving you the classification of various cysts based on etiology, development, etc. That's a old classification. We have latest classification available in 8th edition, according to which buccal bifurcation cyst has been placed under inflammatory cyst. This point I have already mentioned it, but it's not there in the table. So check out 8th edition of Schaeffer's. You can find the table. You can find the placement of buccal bifurcation cyst, that are also called as paradental cyst. So that's one thing I wanted to clarify, right? And also I've asked you about, yeah, my pen's ink is leaking. Hands are all inky. Okay, I'll take care of that later. I've asked you about the difference between urgency and emergency. This was the very same question which was posed to me during my post-graduation by one of our professors. I failed to answer. I mean, not exactly to me. The question was posed to one of the presenters of our journal club, and the question was diverted to us as well, but we all failed to reply. I couldn't answer this question as well. So I'm asking you, what's the difference between urgency and emergency? Now, Sidra seems to be crying toffee. So what shall we do? Sidra is crying. She's saying, she's asking us, like, why are we ending this session? Look at her eyes. Look at her eyes. I mean, she is not even able to open her eyes. Do you want me to still continue? Maybe I think I should continue. Only then she might feel like sleeping. Who knows? So you can use these sessions either to learn, or in worst case scenario, if you think this is very, very boring, just like how Toffee is appreciating this, right? You can use these sessions to sleep. So either way it works out. Rest or digest, or You can pump in with your adrenaline. So whichever suits you. So let me just check out your comments. I think you've answered about differences between urgency and emergency, and let me briefly give you some information. It has something to do with life-threatening situations. So urgency is something which is not life-threatening, but emergency has something to do with the life. If there is any life-threatening instance, right? Yeah. Urgency and emergency. So Toffee, your friends are saying hi for you. Rishikesh is saying hi to you. Toffee says she doesn't care. But even though she tells that externally, deep inside, it has a very sweet heart, right? She, of course, cares. Yeah, I'll definitely convey your hi. Yes. Very good. Good to see you all replying. And do post your scores as well. Yes, do it now is asking what is the best analgesic in pregnant women if pain is not subsiding with paracetamol. Do it now. That's our homework question. Find out and get back through mail for the key or for guidance from our side. Say the emergency is something we're not prepared for. Oh, is it? Then we have these emergency departments in all general clinics. You mean to say we don't have emergency clinic in dental clinic? Seems appropriate, but still, I think we should all be prepared to deal with emergencies, even in dental scenario. Okay, let's talk about dental emergencies. See, urgency and emergency in general context, yes, life-threatening, but dental emergency, do you think it has something to do with life-threatening situations? We talk about avulsion of tooth. We categorize that as a dental emergency. Doesn't take away the life of the patient. So here again, the context varies. Yeah. Danish, very good. So patient has no time at all means urgency. Seems appropriate. Patient says, I'm very busy. I have to go there. I have to come here. Time's up. Maybe you can call that as an urgency. Yes, urgency is a quality of being urgent, pressure, very good. Very good, Sidra. Yeah, left lateral position is indicated. If you're planning for treatment in third trimester, left lateral position, so that it takes away the pressure on inferior vena cava. Well done. We usually don't prescribe antibiotics for relieving pain, just like how we don't prescribe analgesics for treating infections. We cannot crisscross them. But if you address the infection, obviously the source of pain can be alleviated, but we have these analgesics and antibiotics, Ritu. So can you be more specific? Of course, get back through mail. We'll discuss that, and also we'll provide additional information in the form of reference materials. Okay, so we have so many recommendations for first trimester, second trimester, and third trimester. So we'll provide you this handout, this reference material in your e-classes, attach it to this particular live session video. So I hope you're enjoying these sessions, and I'm sure you all have wonderful plans ahead for this weekend. So if you have any queries, you need any further assistance, always feel free to get back through mail 24/7. It's been always amazing interacting with you, having these live interactions, and I'm really looking forward to more of these sessions. So next week onwards, we'll come again with another set of case-based discussions live on YouTube from 9:30 p.m. onwards, Monday to Friday. And before I conclude, as I keep on reminding, just keep these three factors in mind. It's all about hard work, consistency, and self-belief. If you're putting the effort, I'm not going to say right amount of effort. There is no standardization for that. Depending upon your time availability, I mean, your content knows that much better. So if you are giving your best, if you're working consistently, and most importantly, if you believe in yourself, then you have nothing to worry about. If not you, then who else is going to crack the entrance? Isn't it, Toffee? So make sure that you're not getting carried away by so much of negativity that's unfortunately present everywhere all the time. But thanks to technology, it's right with us in our bedroom or in our kitchen or in our hall and even in our washrooms, courtesy these smartphones. So minimize your screen times, just observe nature, the outside world, rather than virtual world, and you'll start experiencing the real positive difference. And as I keep on asking you, like, how many of us are actually observing the sunrise? How many of you have seen the moon last night? It was all reddish, it was almost full. So are we observing nature, or are we glued to these screens? So mental health is very important. In fact, WHO has released a poster yesterday suggesting something in regard to this. In fact, I was so glad that Sidra has asked us this question yesterday about how to overcome lethargy during winter sessions or during winter time. And it's a coincidence that I've come across a post which was released by WHO for talking about the same. See, WHO's recommendations, as you can see, I think it's a mirror, but let me just read out for you. You may be at home more than usual, but you can be active. Sidra, and to others who are feeling passive, demotivated, or lethargic, this is for you. Join exercise classes, even if it is online, that's fun. Dance, enjoy active video games, play sports while staying safe, take stairs, work standing up, and regular physical activity is good for mental health and wellness, including during COVID-19. Healthy living promotes mental health. So this is a recommendation by WHO. I hope you can see. I mean, for me, it appears to be mirrored, but don't worry, if you want, I can share this post as well. So please take care of your mental health and focus on your physical health as well, because each one is like complementing each other. If you take care of your physical health, it takes care of your mental health as well. So with this, let's conclude our weekend live session. So wish you all the best. Love you all. Good night. Rafi, you can say good night. Good night. The session is over. Toffee seems to be happy.